I'm sure you remember this face from sometime in 2023, way before the elections. And well, congratulations.
Thank you so much. Better late than never. It's almost a year now since I won.
Yes, so now that I finally sat with you again back on this platform, congratulations.
Thank you so much, Tinevim. Thank you.
So this is Daniel Molokele, was the Wangi Central legislator and the former chairperson for the Parliamentary Committee on Health. We'll talk about the details of why he is the former chairperson, but for now, let's settle for him being the Wangi Central legislator and also the former chairperson for the Parliamentary Portfolio Committee on Health. My name is Marvelous Nemboti Bagidi, and welcome to the Big Talk, where I'm joined by Honorable Daniel Molokele. Honorable, welcome and thank you very much for giving us your time.
So happy to reconnect with you and excited at the opportunity to have a chat with you.
And I mentioned to our viewers that we once had a conversation last year, 2023, way before the elections.
Yeah.
How has been the journey now that you are now in office? How has been everything going with you?
A lot of drama has happened since we last sat together. Suffice to say that we had to do this rigorous campaign, which, as you might be aware, I managed to win for my second term in a parliament that had a huge turnover from both ZANU-PF and the opposition. I think in every 10 MPs, 7 did not come back. So I'm one of the few survivors who came back. And I was also in October appointed as the Portfolio Committee Chairperson for Health. Unfortunately, at the end of May, I was removed. There's a lot of politics happening. So I'm still in parliament, but no longer chairperson for health, but still the member of parliament for the central constituency.
Thank you, Honorable. You mentioned that you were the Portfolio Committee on Health chairperson, and you were the one word that journalists love using. You were X'd in May. You were X'd in May, but. Despite you being axed, even as Zimbabwean, as an ordinary Zimbabwean, I'm sure we both can agree that the health sector in Zimbabwe is in a deplorable state and has been for years. What does the situation look like now in 2024? Because we've had situations when we were hit by TB, when HIV came into the picture, when COVID came into the picture. I think all those ailments showed us the loopholes and the gaps that we have in the health system. But what does the situation look like now, even when you're speaking as from a place of an ordinary Zimbabwean and as the former chair for the Portfolio Committee on Health?
I have the advantage that at the start of May, I was still the chairperson for the committee. So we did a public tour of some of the institutions. We went to Bulawayo, we visited Mpilo Hospital, we went to Gweru, the Midlands Provincial Hospital, we went to Parenyatwa, we traveled to Bindura for the Provincial Hospital, we also went to Karanda Mission Hospital near Mount Darwin, we visited Makumbe Mission Hospital in Koromonzi. So with a bird's eye view of the state of the healthcare system, we were particularly focusing on diagnostic machines and access to cancer-related treatment. But also we're using that opportunity to tour the hospital facilities. What we see, one of the things that stand out is that the equipment or the machinery or the diagnostic machines in all our public health institutions is very outdated. Most of it needs to be updated. Then second to that, there is a state of disrepair, especially at the referral hospitals like Mpilo, like Parenyatwa, especially when you go to cancer-related diseases. You will see that there are machines that can be in disrepair for 2 years, and that's something that we're really worried about. And then those who need to access like kidney dialysis treatment, there is just like 2 or 3 equipmentation so that a few people can access. So a lot of people are being forced to go to public healthcare, to private healthcare services. Also, access to medicine is a big issue at the moment. Okay. Most prescriptions, you have to go to private pharmacies, even if you're a public healthcare patient. And sometimes people have to bring things to hospital. Like when they are not feeling well, your relatives, they have to buy stuff outside the hospital to bring for the medical professionals to use. But even more disappointing is the high turnover of staff. We are losing a lot of healthcare professionals to our neighboring countries and to the diaspora in general because of the horrible working conditions for our professional healthcare workers. So it's something that is of serious concern.
Okay, you answered part of my second question, which was to do with if the situation is the same around the country, and you mentioned that the tour showed you that shows that the state with the diagnostic machines are outdated. Some of them haven't been repaired in years. There was a case of the radiology machines dying, and I think it's also important for our viewers to know that we only have 3 radiology machines in the public hospitals, and this is not even enough for the population of Zimbabwe. So what exactly is the challenge? Because I'm sure we can afford a radiology machine, the government can afford more radiology machines, but why do we have to have engineers fly from South Africa to fix radiology machines in Zimbabwe? Do we not have the professionals?
It's so sad, it's so disappointing. There is no political leadership. That's the truth. There is no political will, because if you look at the amount that we spend to go and see Victor, for example, that machine that is being bought, that car, can actually buy another diagnostic machine for cancer. So if we are putting money in other areas, it means we are not prioritizing healthcare. And also the fact that most of what they call them, there are some contractual agreements for maintenance that they're supposed to have. Most of them have not been financed enough. So that's why machines can stay for years. And we don't have people who are locally trained, which is something that they need to also invest on as government, to say that let's train locals to maintain these machines. So there's a lot that is happening, but the biggest frustration I have personally is that it's not that expensive. Okay. So it's not a question that Zimbabwe does not have the funding or the financial muscle. It just doesn't have the attitude. And the truth that every Zimbabwean now knows, those who are in political leadership do not go to Mpilo Hospital, do not go to Parenyato. They don't even go to Avenue's private hospital anymore. They go to India, they go to South Africa, they go to China. And that is where the heart of our problem is. And when our still chairperson said, let's invest in public-private partnerships, let's actually build commercialized stations at Mpilo, at Parenyato, so that even our political elite, our rich Zimbabweans, do not need to go outside the country. Then that way, the equipmentation in the private section can, after 2-3 years, go to the other side. Because if you go to the public section, the equipmentation is 15 years old, 20 years old, 30 years old. So imagine if we had a proper private healthcare system funded and supported by government. Because a lot of people don't know that in South Africa, they actually have that system in place. If you go to these big hospitals, they have a public section and a private section. And the private section is used to subsidize the what? The public section. And it works. It works even at the basic level, even like things like bed sheets or curtains. You use them for a certain period, then you take them that side. Instead of having no curtains at all. You see, so Zimbabwe is in that situation where if I was the Minister of Health, I would immediately do that. I would go to companies like Econet, I would go to companies like Stewart Bank and so on and say, let's work together. Because there are wards like at Mpilo, at Parenyato that are empty right now. There's no one.
So we've also, over the years, we've seen so many times periodically, we see photos of a ward in Parenyato where there's rainfall falling, there's water in the flooding in their room. We've had people being sent back from Harare Central Hospital because maybe there's no treatment or the beds are full. But also, could it be that maybe citizens are also play a part in this, because you realize how sometimes someone does not pay the full bill when they're being discharged, and maybe sometimes these people might give false addresses and they might not come back to pay the hospital the amount that they owe. Could everyone be having a share to this decay of our health system?
It's true, but let's look at how efficient our system is, because if you want to be honest, it's just like our taxation system. If you want to be honest, at one stage you realize that you're the only one who's being honest. So a lot of Zimbabweans, when they see a system is working, they support it. But if it's not working, what do they do? So if you put proper mechanism for payments, for debt collection, for whatever, and make sure that the pricing is good, then I'm sure a lot of people will be willing to support. Remember that it is the same people who end up going to private services, which is much more expensive. You have to harness all your relatives, especially those in the diaspora. So a functional Harare hospital or functional Mpilo hospital is a better option than going to private healthcare, where it's much more expensive. But the systems are not there.
Okay.
So those who want to pay will be like thinking, but I'm seeing others, they have too many loopholes. So we need to put the systems in place, and then everyone feels it's a fair deal. It's just like the toll gate. How many Zimbabweans are paying at the toll gate? The majority are paying. But there is now disillusionment that there are some people who just wear a scarf and they don't pay. So now you feel cheated. But the toll gate system, everyone respects it. When I've got a vehicle, I don't question it. But now when I see other people now that they just pass, then I feel like, I'm less of a citizen than the other person. So it's the same with the hospital system. If they properly bill everyone, they put security, CCTV cameras, they are strict, they properly run the system, everyone will pay because it's much more cheaper.
Okay. So you mentioned we're going to Karanda Mission Hospital.
Yes.
And so many people have been going there for surgeries because it's a bit affordable than even places like Perinyatwa or the private, which is way more, probably triple the amount that you get to pay at Karanda Mission Hospital or at the private hospital. What is it that these mission hospitals are doing, despite the funding that they might be getting from their donors or their churches? What is it that they're doing that our private hospitals and clinics can adopt so that we have an efficient health system?
So when you go to Karanda Mission Hospital, you obviously feel that they have now been given the responsibility that clearly belongs to our referral hospitals like Harare Hospital, like Pararenyato, like Mpilo. So they are already overwhelmed. But what drives them is a mission hospital. So it doesn't have a lot of funding, but it has got a lot of heart, a lot of passion and commitment, which you will not necessarily find elsewhere. But at the end of the day, there is sound leadership, there is sound administration, there is systems, there is everything. So when you go there and compare to Mpilo, compare to Pari, you can see that they have set the standard. And people are traveling not just from all over Zimbabwe. They are saying they're getting patients from outside Zimbabwe, from Botswana, from wherever, coming to Karanda, which is not located in a very convenient place. It's out there, near Mozambique, Mount Darwin, whatever. So, but why are people going there? It's because they appreciate the value of the service that they will never get at Mpilo. So it's a failure of our healthcare system, it's a failure of our political leadership. I would say that we can learn from Karanda. We can do better than Karanda. And right now Karanda is overwhelmed, which makes me very sad and breaks my heart that why should Karanda carry the whole nation?
True, because during a visit to Karanda, I realized that with some of their surgeries, like the thyroidectomy, they are forced to do a certain number of patients every week because it's a delicate surgery and it also takes a lot of time. So a surgeon can't have maybe 2 surgeries in a day or constant every single day have thyroidectomy going on. And this talks of how if all the health facilities that we had throughout the country were functioning as efficiently and with sound leadership, I'm sure then they would not be as overwhelmed, because I'm sure when Karanda was built, it was to service the community.
It was very local. Now it's international.
Now it's regional and international.
Yeah.
So like you mentioned, servicing and serving patients from all over the region. And recently there was the Health Resilience Fund that was given to, and that handed over medical equipment and supplies worth over $9.2 million to Zimbabwe, and this is to do with maternal health care. But my question to you is that isn't it that some of these handovers that the handouts that we're getting, and I understand that sometimes it's not necessarily a handout, but it's because of your collaborations with different countries, with different organizations. But isn't it what also is also then crippling our government? We've become a nation which only accepts gifts, accepts funding, but we're personally not investing in our own health system. Why are we so dependent on this funding that will be coming our way, and why are we failing to simply invest?
I have to be honest with you, I think it's a colonial hangover. This donor dependent syndrome is a colonial hangover, because you will see that it's not just in healthcare, but also in other areas, including education. You will find that people want to rely more on international funding. Education and health are the foundation of the nation. They should be funded primarily, but you will see that at the end of the day, we rely more on donors. Look at our HIV response, our ARV program. Most of it is funded by the Global Fund. So what if the Global Fund pulls out? Who's going to deal with this successful ARV program? Who's going to fund it? So you will see that we need to change our mindset as Zimbabwe and say, let's put our priority on health and education. Because right now, if you go to our schools, the primary school I went to, I was shocked to know that children can, in a class, share a textbook. Like a class of 30-something students, they will be having 4 or 5 textbooks. At my primary school, during my primary school days, maybe if they were sharing, it would be 2 scholars or 2 learners per book.
Yes.
If it was horrible, then 3. Now, 10 learners, 11 for a textbook that is prescribed. For me, that is shocking. But no one has been buying books for years now. So we need to challenge ourselves as Zimbabweans to say, why are we depending on foreigners to fund our healthcare? Why are we depending on foreigners to fund our education system? We need to change our mindset, because people just say donors, but donors should complement. So our mindset should shift to say that donors should complement, not should be the basis. It looks like us who are supposed to be the basis of the funding, we are now complementing donors. What if the donors pull out? Who's going to fund our education? Who's going to fund our healthcare? Remember, there's been a promise made by this government, which is almost 10 years old, that had said there will be what? Free education, it's at least at primary school level. It remains a pipe dream. Health for all by 2000, it remains a pipe dream. So I don't want to point fingers. I just want to say, as Zimbabweans, it's time to look at ourselves and say, if we are to respect ourselves, if we say we are a sovereign, we love it, that we are national integrity, sovereignty. If we say that we are now mature and old enough, let's prove it. Let's stop going to India for treatment. Let's stop going to South Africa. Let's stop going to China. Let's stop dying in Singapore. I'm actually humiliated and embarrassed that the late Robert Mugabe, the founding leader of this independent country, died in Singapore. A Pan-African died in Singapore. That's sad. At least even if he couldn't have died in Zim, at least he should have died in Africa, our motherland. But that's how horrible it is. Political leadership must invest in our healthcare system. Look at who is attending our universities. Just double check the political leadership of this country. Look at their children. Are they there at the University of Zimbabwe? Are they there at the MSU? You have to go to Manchester. You have to go to America. These same colonialists, the same Western powers, the imperialists, that's where their children are going to. We've seen graduation pictures of ministers. An obvious example, Mr. and Mrs. Msanga, we saw them in America last year. Their children graduating in America. What about the rest of us as Zimbabweans? The ministers should be focusing on making sure that UZ goes back to its glory days.
And in your closing, Honorable, you mentioned how we have people flying to Singapore, flying to South Africa, and flying to India and China, but then it's only a luxury for the few.
It's true.
Not everyone. You have people giving birth at home. There was the issue during the COVID era where there was an older lady in Bari was helping women give birth because they could not go to the clinic, or there was no one at the clinic, and she was actually just helping them deliver their babies during the lockdown. So you mentioned commercialization of the services at public hospitals, but what else needs to be done? Because we are I think we're in a state of crisis when it comes to our health system. What else needs to be done in addition to the commercialization? What other solutions can you give, recommendations can you give?
There is an opportunity that we have, Tinevimbo. Yes. Right now, as I speak to you, there is a bill that is being crafted by Parliament through the Ministry of Health on the national insurance. We want to access or to improve access to health care, to improve universal health coverage in Zimbabwe. And one of the solutions we have come up with is the national health insurance policy that we want to introduce. Okay. It is like a universal insurance. So it will then make it easier if it's properly administered. I debated around it the other day, and I said our experience, for example, with NASA, our National Social Security Scheme, has taught us that And also our pension funds that we have, mining industry pension fund and so on. What it has taught us is we don't administer those funds properly.
Okay.
But if this insurance is introduced, this scheme is introduced, it will increase our ability to finance healthcare because we are able to pay in installments. We don't need to wait until we have a situation. So insurance helps because even if you are not going to fall ill for 5 years, you will still pay every month in small pieces, in small installments. So Zimbabweans are no longer doing that. We are paying cash upfront, not just for healthcare services, but for other services, including education. But if we are to pay in small amounts over a period of time, then whenever we fall ill, we would go to our hospitals and find the services there. So let's hope this insurance scheme will succeed and that it will be properly administered. The other thing that I'm worried about is the private sector, especially in mining. There's a lot of mining in Zimbabwe. We're one of the most privileged countries when it comes to minerals. We have got chrome, we've got diamonds, we've got gold, we've got coal, we've got silver, we've got copper, we've got lithium. So these big mining companies, I come from a coal mining town. My parent company is Wange Colliery Company. They used to invest not just in education, but in healthcare. So our hospital in Wange used to be a world-class hospital. So I would also push to say these big companies that are investing, there must be some kind of pressure on them, and there is a law that we are bringing in terms of minerals and mining development amendment bill, and I would push that there should be a condition to say that private investors or private sector should invest in health and education, and that will also make a big difference. I am a full beneficiary of the investment that Wange Colliery made on health and education and stopped recently, but when I was at primary school, we really benefited, and that should be the standard where private sector plays its part and gives back to the community.
Thank you very much, Honorable Daniel Molokele. Our Honorable was talking about the state of the health facilities. He was also giving recommendations on what could be done so that Zimbabwe goes back to the glory days. We know Parinyatwa used to be a world-class hospital. You also mentioned how Wange Hospital used to be a world-class hospital. So what needs to be done, what can be done so that our health system, our health facilities go back to the glory days? We don't have Zimbabweans doing health tourism in different parts of the globe, but we actually have people coming in for treatment because we do have the trained and the professionals who are equipped to do those jobs. But sadly, the country is not conducive for them. Hence, we have the exodus of health professionals leaving the country to go to the diaspora. This was an episode of The Big Talk with myself, Marvelous Tinembo Chibagidi. Until the next episode, from myself and the crew behind the scenes, see you next time.